Briefly explain the purposes and format of Case in Point.
Well, Case in Point is an online teaching file database, and it's used for multiple purposes. Residents, it's very popular with residents. They have an opportunity to see some cases that they don't usually see in their daily work. We also offer continuing medical education for Case in Point for practicing radiologists who need to acquire a certain number of hours of training in various different areas. So after they've completed a certain number of Case in Point cases and answered the questions that accompany the cases correctly, then they can get this kind of credit that they need. And it's very popular because it's accessible from home. The cases are short and easy to go through in a very short period of time. So it's been a very, very successful product.
What impact do you think Case in Point is making for practicing radiologists, residents, and fellows?
Well, as I said before, Case in Point is very popular with both residents, trainees, fellows, and with practicing radiologists, I think for slightly different reasons. Case in Point is available online and is a very short bite of information. So residents can look at Case in Point cases in between the cases of their regular workday. So this can be a kind of just-in-time education that they can look at while they're trying to figure out an actual clinical case. And that's very valuable. So I think it's important, as we talk about some of these changes for Case in Point, that we keep the cases short and simple. So even though it sounds like we may be making the cases a little more elaborate, I want to make sure that they continue to be cases that can be reviewed very quickly, because I think that's one of the big advantages of Case in Point. For CME purposes, as we've mentioned before, this is another reason that Case in Point is very popular with practicing radiologists who are constantly in need of CME credits. So we want to make sure that whatever changes we make, we'll still be able to offer CME credits for the Case in Point cases that practicing radiologists review.